been asked by a board member to give at least once a month a COVID-19 update to the public, which I am more than willing to do so that the public is also aware. The school board is updated constantly by me via email, even between meetings. Now, they're not permitted to deliberate on those emails because that would be violating the Sunshine Act. Tonight and last Monday, there are 2 meetings a month, or if they call an additional meeting, is their opportunity to deliberate with one another as a whole of the school board, a whole body of the school board. And so let me begin by also reminding the public that I've spoken about in several meetings already, but I want to remind folks in case they're new this evening, that back in July, when school districts were looking to the Department of Education, the Pennsylvania Department of Education, looking for guidelines from the CDC and looking for guidelines from the Pennsylvania Department of Health, there were very few guidelines about schools because at that point, we were still focused as a country on businesses, getting people back to work. We were focused on public spaces, restaurants, getting our businesses up and operating, which was a very good thing to do. But in July, I need to be ready as a school superintendent to open schools in August, as we do every year. And so at that point, one of our teachers introduced me to an epidemiologist from the University of Minnesota by the name of Dr. Michael Osterholm. And I began reading his research. He is an epidemiologist with 45 years of experience, and he worked closely with the Department of Health in Minnesota to give schools early indicators of following community transmission and how we might return to our schools in America. He is internationally known. His work does not just take place in Minnesota. He also is the director of CIDRAP out of the University of Minnesota. And so I began following his work along with other infectious disease experts and other epidemiologists. His work in late June, early July indicated that we should be watching as school directors, as school superintendents, as school leaders, we should be watching the community transmission numbers. And he does believe in local control and not broad views, although looking at state views, looking at national views and international views are all very important. And I did study a lot of international schools in the summer as well, as schools in Europe began opening up, or schools in other parts of the world began opening up, how we might take some of the things that they learned as well. But all summer, our administrative team studied with our return to school task force how we might be able to return to school safely. So the goal was always to get kids physically back in school. And for those students who they and their families might choose not to return to school, how we could still offer them a quality education and options. So I want to give you that context and that background because early on when school superintendents in this county and this state were looking to the Department of Education for rubrics, and we were looking for ways to qualify the numbers. You know, what's safe? Is 1 safe? Is 100 safe in our community? We didn't know. We didn't have a lot of guidance from the state. And so again, looking at Dr. Osterholm's work with CIDRAP, with the University of Minnesota, he was looking at in July that if the community transmission could stay below 9 new cases a day, it would probably be pretty safe to return to school. And we followed that as a school district, and we were watching the numbers, knowing we are not public health officials. We also, in the county, all of the school district superintendents, as well as emergency responders, were on a call with our Butler County commissioners every Monday at 2 o'clock, starting in March. And that's something that other counties did not do and have since tried to do. Some met with success, others did not. But in this county, we've been very successful with the communication process between our county commissioners, between those in the county leaders in emergency management, and the Butler Health System, where we have an infectious disease expert, and at UPMC in Cranberry, where we have an emergency room doctor who's has many years of experience and is a great resource for all of the Butler County superintendents. So again, in case you're new to listening to our meetings, these are all people I still continue to consult with on a weekly basis. So the numbers I began watching in the summer and tracking, all of us have access to, but they can be overwhelming. So if you go to the Pennsylvania Department of Health website and you go to the Pennsylvania Department of Education website, there are many, many, many resources that can make it difficult for our parents and our general public to kind of sift through to determine what should I be looking at. I want our public and our parents to know that two sources that I'm constantly reminding our school board about is the Pennsylvania Department of Health COVID-19 Early Warning Monitoring System dashboard. Now that dashboard, if I remember correctly, came out in August. I don't have the exact date, but again, I needed to be prepared to open school this summer, ready for August. And so I was disappointed. I continue to be disappointed at times with the slowness of our Department of Health in getting us the metrics we were looking for as school superintendents, but they did. And so now we are watching that. That's the Early Warning Monitoring System dashboard. So in that dashboard from the Department of Health, you can sort by county. You can look at the state numbers. They are important to look at. You can also look at the data by county. So what we've been doing, and Lisa Mislin, who sits here as the secretary for the school board, as well as my assistant in my office, she tracks these every day for us in a separate spreadsheet so that we too can watch the data from a district perspective. And she has been tracking the number of new daily cases since August 18th, which was about 2 or 3 days before our teachers returned, because I wanted to see this over time. First, we layered in as a school district our 12-month employees returning in July. They were working from home and doing quite well, but we were layering in more people on campus and in our buildings to pay attention to the cases and see if our mitigations were working. So then we layered in the teachers. And again, since that time, we've been tracking cases. So the first week that we tracked on the Department of Health website, new daily cases was August 18th. And we track those on a 14-day rolling average, which again is what Dr. Osterholm takes a look at. And in the 14-day rolling average, then when we get the new daily average, we take away the earliest date on that. So the weeks, 14 days from August 18th through August 31st, to give you perspective, we were at a 4.6 14-day rolling average in the county. Our most recent 14-day rolling average. So before our teachers returned, we were at 4.6 in the county. And we are only one school district, as you know, in the county. And this tracking goes on, and I constantly share it with the board, share it with teachers, anyone who would like to see all of these numbers. They are overwhelming. If we look at the most recent count that I have before me, we are on the 14-day rolling count from September 28th to October 11th. 14-day rolling average is 15.6. So that gives you a perspective. On average, new daily cases in the entire county. That is just something we keep locally to pay attention to. And that was something, again, we began looking at very early in the summer per Dr. Osterholm. There are many data points for which we are viewing the daily cases. That's just one of them. Let me go to the next. As a member of the Butler Health System Hospital Board, I receive daily updates from the CEO. Those are not secrets. He shares those with all of the employees, and I know he shares those with the public as I've seen those numbers in the newspaper. So as of today, there is one patient in Butler Hospital with COVID and none in the ICU. That's another viewpoint for which we constantly are watching every day. I wanted to give you today's numbers. The next data point that we take a look at is then Lisa goes in, and this is very labor intensive, and she tracks on the Pennsylvania Department of Health website our school district numbers by zip codes. So we go into the zip codes, and again, we've been doing this for a while, and on the zip code page, we began, again, tracking because the next layer now, after 12-month employees and teachers returned, approximately 600 teachers, now we have about 900 employees across all of our campuses. Now we start up with the bus drivers and the students in the cohort model. So we begin tracking by zip code on August 28th. And the first date that we tracked, again, it's all there. You just have to go back in the data if you want to see earlier than August 28th. We were looking at a total of 294 positive COVID cases confirmed from the following zip codes: Callery, Cranberry Township, Evans City, Harmony, Mars. Yes, we have students who have Mars addresses. I think they live in Seven Fields, but they are our students. That's why that zip code is included. But we recognize not all of those numbers in the Mars zip code would be necessarily attributed to Seneca Valley. That would be anyone who has a Mars post office box or Mars address, 16046 zip code. Renfrew, Zelian-Opal. So for a total on August 28th of 294 cases since the pandemic began in March. There is no daily count, the way the Department of Health divides out the daily cases. But Lisa goes in periodically to give us a snapshot. And so when we began tracking this, we could see in our district, for instance, on August 30th, between the 28th and the 30th, we had 6 new cases. And then you can compare that to the daily cases in the county. And obviously our cases would be much lower than the entire county. Then we go to, we track that, as I said, we go in about every 1 to 3 days and divide out that data. So to give you an example, today with those zip codes, as of October 12th, we are at 3 new cases. And you can mine this data on your own. It's not something that is secret. It's on the Department of Health website. That is a data point that, again, the board is always looking at. I am always looking at. Let's go to the next data point. The next one is called, before we do that, let's go back to the early warning monitoring system dashboard, because this is something that's been brought up by board members and by public members. So the Department of Health in the state of Pennsylvania, they don't track by 14-day rolling averages. That's a snapshot we look at as a district based on Dr. Osterholm's research. They track the most recent 7-day period as compared to the previous 7-day period. And so when you go to the Pennsylvania Department of Health website and you type in COVID-19 early warning monitoring system dashboard, all of these links are also on our website and they are under COVID-19. We see when I look at this data, so I pulled some of this from September 25th through October 1st was a 7-day period. And that was the most recent one. I pulled that last week. And then, I'm sorry, it was 2 weeks ago because I pulled it for last Monday's school board meeting. And then compare that to the previous 7-day period on September 18th to the 24th. So those 2 7-day periods, at that point, the difference in confirmed cases, which is the most recent 7-day versus the previous 7-day, was 21. So in the county, in Butler County, we had 21 new cases from the period of September 18th through the 24th, as compared to September 25th through October 1st. That same data today, when we pull it, it's 28 cases. So you see, this is an additional view, 21 to 28 cases across 7 days. Then we go to incident rate. And in one of the views, we see 33 for incident rate per 100,000 residents. And today, 49, or most recent data, 49.5. Now, when I say most recent data on the Department of Health, that's September 25th through October 1st when they do their snapshot. PCR percent positivity rate, you've heard that talked about in public here. We were at last Monday's meeting, 3.1% in the county. We are now at 3.8%. Then it goes on to talk about in the graph, how many ventilators in the county that would be attributed to Butler Health System, how many people are in the hospital. I shared, with COVID, I shared today's number. In that dashboard, we are seeing a slight uptick in Butler County. So I did want to point that out. And an increase from a rate of 34.6 previous 7 days positivity of cases in the incident rate to 49.5 in the most recent 7 days per 100,000 residents in the county. There are approximately 200,000 residents in Butler County. So again, that's another view. I also want you to keep in mind that the Walmart Cranberry testing site has closed due to a lack of demand. And so that can impact, not necessarily, well, it can impact your positivity rate, but most certainly your testing rate, unless individuals choose to go elsewhere, which they most certainly can and do. The next item I want to point out, I know this is a lot of data, but I want the public to see what we're looking at on a constant rolling basis, 7 days compared to the last 7 days, 14-day rolling average, county numbers, zip code numbers. Then we go to the recommendations for pre-K to 12 schools following the identification of a case. You heard me talk about this last week. You know, what will it take to close the building? People ask me, or what won't it take to close a building? You know, they've asked me both. And this is a public document. Again, this came out later than superintendents had hoped for. This was more of an August data point, metrics, but we were glad to get them. Butler County is considered by the Pennsylvania Department of Health and the Pennsylvania Department of Education as a county that has moderate transmission. We knew that when we moved from cohort to 5-day a week. Certainly the board knew that as well and considered that and weighed that in their decision. Under the moderate level of community transmission in the county, if we have one student or one staff member, the school does not need to close, and we are to clean the areas where the student was, whether that's buses, classrooms, cafeteria. If we have 2 to 4 students or staff in the same school building, or less than 5% of the total number of students or staff in a school building, or multiple school buildings with individual cases who are not household contacts, then it is recommended, not required, but recommended that we close schools for 5 to 7 days. We clean those areas where the student or staff member spent time. If we have the next category, if we have 5 or more students and staff, so that could be 2 teachers, 1 administrator, 1 teacher, and 3 students. You know, they put them together. This is not 5 students and 5 staff. It's 5 or more students and or staff in the same school building, or greater than equal to 5% of the total number of students, or multiple school buildings with 2 to 4 cases who are not household contacts. Then they are recommending, not requiring, that we close schools for 14 days and clean. So I repeat this because we do not, to date, as I sit here tonight, since we have opened school, we have had 1 elementary student and 1 12-month employee here on campus that are known and shared with us that they had COVID. And in both of those cases, there was no need to quarantine anyone else in school. Of course, we don't do the quarantining, the Department of Health does, but according to the contact tracing and Department of Health, in both of those cases, it did not impact other individuals in our schools. When we listen to Dr. Osterholm's research, he indicates that it's community transmission that will be brought into the schools, not necessarily school transmission, because in his opinion, that, you know, schools do a pretty good job of following the rules. We are rule followers, and if we're told to mask up, we mask up. If we're told to social distance, we social distance as best as possible. Of course, the Department of Education said when feasible. When we went from cohort to 5-day a week, it just was not feasible in many of our classrooms, if not a majority. And we've been honest and open about that. That was a risk that the board and many of our public, our parents were willing to take. But we are still doing as much as we can to mitigate the spread and the transmission. We have a lot of plexiglass. When I talk to my colleagues, I think, I can't prove this yet, but I think we have more plexiglass than any other district that I've spoken to. Our cafeterias, there's a lot of plexiglass because we do know when students take down their mask, they're more vulnerable while they're eating. We have opened up other areas in all of our cafeterias for students to eat at tables in the halls, for students to eat outside at picnic tables, for students to eat in bleachers in our gymnasiums. So we have large common spaces that we have also converted to places where students may choose to eat. The students are being very compliant with masking. The students are being very compliant when they can social distance, they do. Sometimes they need reminders from us because they're kids, but we're very kind and polite about that, and they're very compliant. So I'm very pleased with the way things have gone in only 1 week, but I would caution us, and I say 1 week, meaning 5 days a week in person. We know that we were in school in cohort for 4 weeks, and that was much easier to control and contact trace if anyone called us and said, you know, I'm not feeling well, or I'm waiting on a test result. All of that information is run by our nurse administrator, our school nurse, Liz Williams, and she tracks every single case that is reported to her. And then I get that spreadsheet without names, it's just case numbers. And, you know, we often do have people who aren't feeling well and go and get a test and they stay home. And that is the best thing that we can do. That's step number one in mitigating the spread. If you don't feel well, you don't come to school. And that goes for the adults and the students. So people have been very honest and open with Nurse Williams, and I appreciate that. And I want to encourage our parents and the public to continue to do that because that is step one. Step two is also, even if you are feeling well, that every adult in this district, we take our temperature and we report it on a form that goes to Human Resources, and we answer questions. That includes me every single morning. And that goes for students as well. They don't fill out a form and send it to Human Resources, but we do ask that the parents monitor their child's symptoms and take their child's temperature. And if the parent should forget, because we know, you know, we're not perfect and sometimes you might forget in the morning, we have temperature scanners in every building, and they've been very discreet and so far pretty effective. So all of these mitigations together is how we hope to keep the transmission rate very low in our school district and continue. But again, I will caution us, we've only completed 1 week of 5-day-a-week in person. We are prepared if we have to go remote or back to cohort, whatever the board would decide based on cases, but sometimes these things happen quite quickly, and I may need to make a decision with the Department of Health. If we would get a cluster quite quickly, I would notify the board and we would notify parents right away if there would be a change in the instructional model, because we won't always have time to come back to a public setting and decide that. But I will keep the board, I will be in close contact even between now and our next meeting in November. And I would just ask for the public, again, to be kind, understanding, and flexible. I know it's very disruptive to parent schedules if we should have to close a building or a classroom, but we are prepared to do so. And if in consultation with the Department of Health, we need to do that, we will do that. And certainly we won't take that lightly. We know it's a disruption to parent schedules. But at this point, we're very pleased with our first week of 5 days in person. And we're very pleased with the amount of work and the diligence that our teachers have put into this year, not just teaching, but thinking about health and public safety. So again, if you listen to Dr. Osterholm, he'll be live this Tuesday. You will hear what I've been hearing over and over. If we want to keep our schools open, we must keep community transmission low. And the not local transmission, because I don't have that qualitative data, but across the United States so far in contact tracing, and this is not a judgment, this is simply from listening to the research and the doctors and the infectious disease experts, transmission is occurring at funerals, weddings, family parties. Again, doesn't mean we, have to stop living our life. We still need to find safe ways to coexist with this virus. But if we are seeing an uptick in community transmission, we need to all of us do our very best to control that and make smart decisions in small groups as much as possible. Certainly, the research also indicates that being outside, and I saw classrooms outside today. I love seeing that. But anytime we can be outside versus indoors helps as another layer to mitigate the spread. Again, that's from the epidemiologists, that's from the infectious disease experts. So as we start to think about Thanksgiving and Christmas, I know that will be a challenge with family parties, but if we see an escalation and we continue in a trajectory upwards in our community, zip codes and county, it could impact our schools. So I want to be honest and upfront with the public.
I do have one question, Dr. Vitale. When folks ask us about the social distancing in the classrooms, and you mentioned it about the plexiglass and how we probably have more plexiglass than anyone, that is one of the mitigators that we use in the classroom to help out with social distancing, to have that physical barrier. And I think that that's something that, although you can't always have the social distancing, the barrier helps improve that. So just if you could talk about how it might be used in a classroom, or how it is being used in a classroom, just so folks get an idea of the prevalence that we do have of the use of plexiglass.
Sure. I can speak to classrooms, and Dr. McKinley can speak even more to secondary classrooms. Dr. McCarty could speak to elementary classrooms. In cafeterias, anywhere students are sitting less than 6 feet away from one another, there is plexiglass. We saw a couple areas last week that we wanted to improve, so we've ordered even more plexiglass, and in some cases took plexiglass where it wasn't being used as frequently, and took that during lunch. So we think, all of last week we were troubleshooting, looking at buildings, looking at classrooms, looking in the cafeteria, and working closely with our union leaders on what do you need, what do you see, what are you hearing, and where can we be better? Because none of this is perfect. We've never done this before, none of us. As a matter of fact, most summers are spent ordering supplies, fine-tuning our technology, tech department reimages computers. It's still a very busy time, but the principals typically have all of April, May, June, and July to build schedules, customizable schedules for our students, for 7,400 students. This year, they had to build and rebuild, with the counselors, at least 3 master schedules. Normally you do 1. And they had to hand schedule thousands of kids. So just to show you, again, the amount of work that occurred this summer. But when it comes to plexiglass, that is, and if you listen to Dr. Osterholm, it's not one mitigation strategy that works. It's not like we looked at plexiglass in the summer and said, oh, that's it. We just do that and everything will be fine. It's a combination of knowledge about the numbers, watching community transmission and figuring out, if you can, with the Department of Health, where is this happening? What types of places? Not to judge what people are doing, but to make sure we're educated about it. It's difficult because this is private health information. So you want to be honest, you want to be upfront, you want to tell your public everything you know, but in the same token, you want to protect the privacy of children and families. Masking, of course, is another mitigation strategy that we've been very strict with at Seneca Valley early on. Even before the masking order, we were talking about this in our return to school task force. And I know early on there was a lot of debate about whether it works or not. It's another layer. We know it's not perfect. It's another layer. Talking about cleaning at night. We have misters with vital oxide, very expensive chemical, very safe chemical. Hospitals have used it for a long time to disinfect. We spray down every room every night. This room will be sprayed down when we leave tonight. That's another layer. Getting students outside. The foundation bought tents. If you can get outside, I saw a physics class outside today, this afternoon, in front of the senior high. Last week, I saw a chorus class outside, and the chorus teacher was running between 4 groups of students because they were all divided up into different singing parts. I see constantly, our band teachers moving instruments back and forth. We giggle about it anymore. They are some of the most flexible people I've ever met in regards to, well, now I'm going to go teach in this classroom where I can spread kids out. So I think all of these different layers of knowing how the virus spreads, and there's still debate about that. There's still ongoing research, but every day when a research study comes out looking at that, like early on, we were studying in July about HVAC systems, and we commissioned a study by our engineers on all of our HVAC systems in our buildings. There are schools that haven't even thought about that yet. So I'm very pleased. Our nurses, several of our nurses went to a contact tracing class at Johns Hopkins over the summer, virtually. Even though they aren't doing the contact tracing, they understand it, and they can assist the Department of Health, especially we're a big school. We have to coordinate, we have to communicate. So there's just so many different layers to this. All of these mitigation strategies together will hopefully keep our numbers low, but none of them will work if our county and our zip code numbers, if our community transmission spikes, it won't matter what we're doing in schools. It will come in and it will be tough to contain. So we need to, as a community, constantly ask ourselves, yes, we need to live our life. Yes, we need to go to the grocery store. Yes, we need to see family members. How can we do this as safely as possible? And how can we be smart about how we're meeting people in public situations? And being outside is one of the best ways to mitigate the spread. Not the only way, but one of the best ways. So I'm sorry, that's a long-winded answer, but I live this every day and every night and every weekend, and I'm interested in it because I want to keep our schools open. So the more I can learn from epidemiologists, the more I can learn from infectious disease experts, public health officials, that's who I listen to, not mainstream media.
Thank you very much, Dr. Vitale.